Hi, Oluchi here. Medications, part 3, I believe. So today I'm going to talk about anxiety medications, just a brief rundown of the most commonly used ones. So first of all, before I do that, I want to emphasize that the same precautions you use for narcotics, you use the same for anxiety medications, because many of them are controlled drugs. So what I mean by that is that if you need to waste it or you need to return it, you will need a witness. Another nurse will, witness and sign off that you returned it or you wasted a portion of it. Then, number 2, when you are giving it to the patient, make sure that the patient is aware that you are giving him or her his anxiety medications. You can state the dose and you can state, any other information that the patient might want to know about the medication. So just make sure the patient knows that he's getting his anxiety medication. Then, like I said, make sure you watch and see that the patient took that medication, not maybe hid it somewhere, maybe hid it at the back of their mouth, or did not take it and waited for you to go out and then stockpile it to use it for suicide. They do the same thing with the narcotics and the anxiety medications. So make sure that all those are done. Now, the anxiety medications, the most commonly used ones are the benzodiazepines. That's diazepam, lorazepam, midazolam, alprazolam, and then clonazepam. So it's very easy to identify them with since they have a suffix of BAN. It's easy to identify that this is a benzodiazepine. But note that many patients that are on this, I'm laughing because almost everybody in America has anxiety. So many people take it. And they know the medications by their trade names, not the generic names that I just mentioned now, diazepam and all that. So it would serve you well to know the trade names, or at least the most common trade names for this medication, so that when you are communicating with the patient, it's easier. Because if you come and the patient asks for a particular medication and you don't know, you may know what diazepam is, but you don't know that they call it Valium. So that one is even common, but these other ones like midazolam, the trade name is Versed. So if the patient asks for Versed, you might not know what it is at first if you are not familiar. So it will be a good thing for you to familiarize yourself with the trade name, because I tell you, anxiety meds are so common that almost everybody takes them. So like I said, for diazepam is Valium, for midazolam is Versed, for lorazepam is Ativan, for alprazolam is Xanax, and then clonazepam is Klonopin. There are some other ones, but they are not as common as these ones, especially diazepam. What's the second one? Lorazepam, and then Versed or midazolam. So take note of the names. Then another set of drugs that may seem like they are similar to anxiety medications, because sometimes people use them interchangeably, some psych medications that are mostly mood stabilizers that some practitioners or providers may give the patient to stabilize their moods. So the most common ones are Zyprexa, which is, the trade name is Zyprexa. The generic name is olanzapine. And then there is Seroquel, which is the trade name. The generic name is quetiapine. So those ones too are commonly, the patients know those medications. They know when you say you are giving them Seroquel, they know what that is. Then another set of medications that are used for anxiety, even though they have other uses, is Benadryl and Atarax. So these medications, they are first generation antihistamines. So they are used to treat allergies and itching, but they have anxiolytic effects. That's, they take care of anxiety too. So they are also used, for treating anxiety. So also take note of that. Atarax, the generic name is hydroxyzine, and then for Benadryl, it has a bunch of other trade names. Benadryl is the trade name, I believe. Yeah, I cannot remember what the generic name is right now. So these are the most common medications used for anxiety and mood stabilization, and they are very common medications. You want to learn those ones first with the narcotics, and then as time goes on, you learn the other things too. Now, in the next video, I'm going to talk briefly about some sensitive medications such as heparin and insulin, and then maybe touch a little bit on antibiotics. I think that should do it. Thanks for listening. Make sure to like, share, subscribe, and follow for more.